Well, mosquitoes infected with West Nile virus, they have been found in Santa Clara County, most recently in portions of Mosquitos and San Jose. 8 out of 10 people infected with the West Nile virus won't develop any symptoms at all, but they can be serious and sometimes even fatal. Joining me now is Dr. Desiree LaBeaud, professor of pediatrics at Stanford. So thank you very much for joining us. Let me ask you, what are the signs and symptoms to be aware of, and how long does it take to get sick if you're bitten by an infected mosquito?
Yeah, so as you mentioned, 8 out of 10 people don't have any symptoms with West Nile, but about 1 in 5 do, right? And so those symptoms are usually fever, headache, maybe some body aches and joint pains, a little bit of nausea and vomiting. And that's what we call West Nile fever, which is the non-severe syndrome with West Nile. Usually people get better. Some people can have lingering weakness and fatigue that lasts weeks to months and can impact school and work, but most people completely recover. The severe symptoms to watch out for happen in about 1 in 150 people. And that's when West Nile virus infects the brain or the spinal cord. And so you can see symptoms like very high fevers, severe headache, severe vomiting. You can have stiff neck, painful eyes with light, a lot of maybe weakness, even sometimes seizures and confusion, coma. And those are the most severe cases. And that, again, only happens about 1 in 150 people.
Do we know?
You asked me about just the incubation period. It usually takes about 2 to 6 days from the infected mosquito bite to when people show symptoms. But it can be longer in people who are immunocompromised.
I was curious, do we know why some people get those severe symptoms and others do not?
No, we just know that there are certain groups that are at higher risk. So people who are above age 60 are usually at higher risk, and then people who have certain health conditions like hypertension or kidney disease or diabetes, and people who are immunosuppressed with cancer or having an organ transplant can be at higher risk for those severe symptoms. But unfortunately, severe disease can happen in all ages of people.
Absolutely. So we know there's no vaccine for humans. So what should people do if they do become infected?
Well, so if you're showing symptoms, you or a family member are showing symptoms of West Nile, it's probably important to reach out to your healthcare provider. As I mentioned, people with just West Nile fever will just have fever and body aches that self-resolve. And so usually over-the-counter medicines and rest and fluids will take care of your disease. But for those who are showing those severe symptoms that I mentioned, you know, the vomiting, the stiff neck, any type of weakness, or just very severe symptoms, you need to reach out to your healthcare provider because it's likely that you might need to be hospitalized for monitoring and nursing care and supportive treatment.
And what steps can we take to reduce our risk of becoming infected?
Well, the only way you can get West Nile is being bitten by an infected mosquito. So you need to protect against mosquito bites. And we all know how to do that, right? So you can wear mosquito repellents. We can wear loose-fitting clothes, you know, long sleeves, long pants so that mosquitoes can't bite us. We can also spray our clothes with permethrin or something that's a repellent for mosquitoes so that they don't want to land on us or land on our clothes. We can make our home safe by having screens on our doors and our windows, you know, use air conditioning if that's possible and keep your doors and windows closed. You can limit your outdoor exposure to when those mosquitoes are biting, which is between dusk and dawn, right? So maybe come indoors then, especially if you see a lot of mosquitoes. And then mosquitoes need to breed in water. So you can look for standing water out in your yard, you know, dog dishes or toys or flower pots that are collecting water, you can dump those out. And if you really do find that you have a problem with mosquitoes in your neighborhood or in your home, you can reach out to your county mosquito control district. I personally sit on the board of the San Mateo County Mosquito and Vector Control District, and I know personally how committed they are to really ensuring that everyone in our county is safe from West Nile.
Absolutely. Always good tips, always good reminders. Dr. Desiree LaBeaud, thank you very much for joining us.
Thank you for having me. Have a great day.